Hi, Mary.
Hello.
Mary, did you have a contact from WEAU?
Yes, I did. Thank you. We're going to connect after the meeting.
Okay. Good. I told him you're more articulate than I am and you look better than I do. So,
Don't set me up that way, Nick.
looks like we have two Corp Council reps here.
They're doubling up on us.
Your lucky day, Nick.
Yeah.
Say, Ray Hennig, I got your message and I couldn't open it because when I pushed to have it show, up came a great big red screen telling me that I shouldn't open it. So I don't know what your message was, but it was considered dangerous.
I didn't remember sending you one.
Did you send me a messenger message
When?
within the last couple of days?
No, I don't believe so.
Oh,
That's
then somebody else has hacked your account.
Yeah. That's a phishing thing.
Gosh, and I thought, holy cow, I'm going to hear from Ray that first.
No, I would have called you on the phone.
There you go.
So,
I'm trying to sit near the window where the sunshine is. I can remember what it looks like.
Colleen, you are sunshine.
Oh, yes.
oh,
Well, that wasn't the weather I had in mind.
It's about 1 minute to the start time here.
And Nick, we do have a quorum. I'm expecting one more board member to join us, but we do have a quorum with everybody else when everybody else is ready to start.
We also have a quorum.
Great. Love it when that works out.
It is now 2:30. Call to order the Committee on Administration. Mary?
And we'll call to order for the Eau Claire City County Board of Health.
Okay. Samantha, will you confirm the meeting notice?
Yes, it's.
Thank you. Would you do the roll call of the Committee on Administration, please?
I can. Supervisor Henning,
here.
Beckfield,
Here.
Bates,
Here.
Wilkie,
Here.
Smyer.
Here.
We have quorum.
Mary, who's your, do you want to go for Mary? Or?
Yes, I will do the roll call for the Board of Health. Emily Berge.
Here.
Don Bedell.
Here.
Ready.
Here.
Mark Kading.
He was here.
Can see him. No, he was here. Mark Kading.
I'm here.
There.
Thank you.
You're welcome.
Martha Neiman.
Here.
Spencer.
Here.
Terry Miskman, I believe, is absent. Okay. We are
So
good.
we both have quorum then. Eh?
Yes. We have.
Okay. Next on our agenda is public comment. We're going to handle public comment the way we do it ordinarily at County Board. That is maximum of half an hour, 3 minutes per speaker. A reminder to those who are presenting comments, this is a one-way presentation. It's not dialogue or back and forth questions. It's simply a comment. I'm going to ask Samantha to help out here because we have a list of people who have submitted comments but do not wish to present comment meeting. And so Samantha is going to go down the list of those who we submitted comments for and those who submitted comments against. Samantha.
Yeah, if I could just remind everybody to stay muted. So the first comments I'm going to read here are in favor of file number 2021-100, the mask ordinance. Kayla Rick, Adam Acola, Rita Dorsey, Kent Buell, Jessica Hammock, Catherine Bushman, Sarah Fuller, Sandra Ringel, Elizabeth Lindsay, Celeste Snyder, Ronald Rickey, Tara Sabin, Allison Jones, Barbara Van Rees, Betty Cowley, Teresa Oberweis, John Lee, Angela Swenson Hollinger, Rebecca Pun, Linda Carlson, Sue Leonard, Chris Severston, Kelly Murray, Thomas Sanford, Christina Milton, Mike Blazel, Cheryl Leonard, Nancy Soley, Linda Larson, Rita Volbrecht, Christine Geff, Sean Geff, Michael Geff, Sarah Geff, and Karen Spires. And the following voiced their opposition to file number 2021-100. Cassie Draper, Dane Herman, Don Hakes, Ralph Palmer, Jeffrey Matsik, sorry if I didn't pronounce that correctly, Brandon Rice, Sarah Gordy, Andrew Cleveguard, Amy Walker, Joshua Andrew, Tony Jonkowski, Heather Knutson, Benjamin Van Gore, Sarah Somick, Ashley Hansen, Julie Dick, Aaron Decker, Charles Reeder, Jason Baker, Tucker Tage, Angie Frank, Tanya Hagan, Justin Frank, Ethan Frank, Tammy Depburn, Tom Harrow, Tom Gores, Gerald Galloway, Jamie Galloway, Ann Dettinger, Paul Eulig, Kyle Woodman, Larry Jonkowski, David Kincaid, April Duvall, Mike Klotz, Ken Bolton, Caleb Drummond, Carol Puce, and Anne Marie Kallenbach. And we do have some members of the public online for verbal comment. And we will begin with Linda Larson. Larson. We will move on to Rita Volbrecht. Rita, are you online? We will move on to Don Hakes. Brandon Rice.
Samantha, I can hear voices in the background. It sounds as if maybe they're not connected at full volume or they're having difficulty. Has anyone else heard a voice, small voice? Let's start the list over.
Yes, Mr. Chairman. I think they're trying to come on because their squares light up here as if they're coming on, but they're not coming through for some reason.
What the problem is. Let's start over, Samantha.
Sure. Just as a reminder, unmute your device to ensure you come through. And we'll begin with Linda Larson. Rita Volbrecht. Don Hakes.
How about anybody at this point? Seriously.
Hello? Hello?
Yes.
This is Carol Poise.
Go ahead.
You want me to go ahead?
Yes, please.
Okay. All right. Thank you for the opportunity to speak today. The point that I would like to make is the information on file number 20-21-073, which had the dates and times for the meeting on the proposed mask ordinance. It stated that today, January 12th, there would be a joint meeting of the Committee on Administration and Board meeting to review the draft ordinance. It was called to my attention yesterday that this meeting was going to be a time for public comment with only a 30-minute maximum for public comment, which is not what was on the original schedule that was stated. There, I am sure, are many people who cannot make comment today because they are working. This is not clear information going out to the people who want to speak today. I feel that this is very unfair. This ordinance affects everyone in this county. Who is the person in the health department that would make a decision to activate the mask ordinance? In 8.35.707, it states any successor face covering order of the governor is vacated by a decision of the Supreme Court of the state of Wisconsin, or if the governor does not extend the order. If the or what was it called? Strong? Oh, advanced?
Carol, you're just cutting out.
Did we lose her? I think we lost her.
I'm not sure I see her. Just as an FYI, Carol's comment was included in the comment packet that I sent you.
I meant to remind everyone that this packet that has all of the comments, plus the indicators of those who wanted to speak today, that will go out to all the members of both the Board of Health and the Committee on Administration, and ultimately to the County Board.
Chair Meyer, if you don't mind, I will pick up where Carol left off according to her written comment. It's just a few more sentences. Her comment is, if the order is not extended, Eau Claire County should not be forcing the residents of this city and county to continue masking. It is also unfair to have the 8.35.060 enforcement to be part of this ordinance. Charging people $200 per incident is truly unfair. If masks work so well, why have there been all of these spikes? People are getting the vaccine, and also people who have already had the virus and are immune will still be forced to wear masks. There are too many things that do not make sense. Please do not put more rules and laws on the people of the city and county. Enough is enough.
Thank you. Let's go on to anyone else who is online.
Kyle Woodman, are you online?
Yeah, Kyle Woodman here. Can you hear me?
I can.
Yeah, just real quick here. I don't think we need to pass a law forcing everyone in the county to wear masks. I would rather we just let the people choose. And I don't mean let the people choose to vote for a law and choose. I mean, let the people literally choose if they want to wear a mask or not. We don't need to go around and force everyone to wear a mask if they don't feel that it's necessary for their health. I think their health is their responsibility. If there's another individual that feels they're at risk, they should stay home. We did this all summer. If you're at risk, stay home. Not a big deal. Get your groceries delivered to you. But don't tell everyone that we all got to wear masks. If someone's at risk, just stay home. Okay? If another individual wants to go out and take the risk, that's their choice to do that also. Okay? Individual freedoms, it's our choice to do what we want. The bottom line is I'm just not in favor of any law forcing someone to do something that they don't want to do. Their health decisions are between them, their God, and their doctor. Okay? In a normal world, I would be going to the doctor to find out if I should wear a mask for my health, right? Not going to the doctor to get excused from wearing a mask. Okay? So this is just getting really crazy. At the very most, we should be regulating the sick, not the healthy. So I would rather just leave the people alone. We don't need Elizabeth Giese following us around in our cars with a pair of binoculars to see if we're wearing masks or not. Okay, I don't need her telling me when I can and can't leave my house, when I can go shopping or not, or what time my curfew is. I'll come home when I want. Okay, she's not my mom. And another thing is why is the fine $200? What's the money going to be used for? I haven't heard what the money is going to be used for. If you find somebody $200, where's that money going? Is it going to the health department? I don't know. Is it going to the buses downtown? I think that'd be something I would like to know. Maybe it's posted somewhere and I missed it. I'm not sorry if I did. I'm just wondering, is this a scheme for the health department to enrich themselves? I don't know. Another thing is the Eau Claire County population is approximately 105,000 people. We've had 10,000 cases and 97 deaths, which is sad, obviously. But that's not even 10%. That's not even 10%. The cases is not even 10% of the county's population. So the 10,065 cases is not even 10% of our population. And of those, that 10%, we don't even have 1% of the deaths, okay, which we don't want anyone to die. But basically what I'm saying is if you look at the numbers, I don't think this is something that is going to warrant infringing on people's individual freedoms, forcing everyone to do something that they don't feel is necessary, okay? So I would rather you just leave my health up to me. I don't think my health is any of your business. I would rather just live free. So thank you.
Tanya Hagan. Tanya Hagan. Tony Dunkowski. Tony Dunkowski.
This is Larry Jankowski, if that's who you're looking for.
Go ahead, Larry.
Okay. Short answer, agree with the gentleman that just stated his point. Actually, we've got two things going on. You're attempting to, by this ordinance, extend something that's illegal in the face of it that our governor has consistently shot down by the Supreme Court for attempting to do without any medical basis. The other issues we need to talk about, masking doesn't work. Very simply, there's no point. California has some of the strictest regulations in the U.S. and COVID-19 is still surging. Mask mandates in Florida and nationwide show that masks actually increase the amount of infections. These links are all been provided in the comments I sent in. There's also been a study of over 10 million people in Wuhan, China, done by U.S., China, Australia, and UK that showed in that 10 million, not a single asymptomatic transmission of COVID occurred. Asymptomatic means basically you don't have any symptoms, which is the way these things work. It makes no sense for this masking to occur. It's a major overstep boundaries. A couple of comments I have is that it also appears to be what looks like a major level 4 HIPAA violation. It's a highest penalty for HIPAA violation. Level 4, the action has to be willfully or willfully negligent and no timely attempt to rectify the situation. HIPAA violation fines are serious. I work in those on a regular basis for banking, biomedical, biotechnical companies, and I'm curious as to who within the county thought that they're capable of dealing with a HIPAA violation of this order of magnitude. Realistically, this is a real serious overreach. Leave me alone. Let me do what I need to do. If I feel I'm at risk, I'm good to go. Realistically, I am not. I'm asymptomatic. And technically, a lot of us in this area believe we got hit with something similar about the last week of November and December last year A lot of us in churches and other environments got nailed with what we called the crud, which lasted 4 to 5 weeks. Really brutal flu. You go to the hospital, they don't tell you what you actually got. Nobody knows. And that went through in between Thanksgiving and December. Realistically, I think a lot of us have already immune to it. The reality is this has a 90, in my age group, great. Even CDC says we've got a 94.6% survival rate. That's better than a lot of other things you do in real life. There's no need for this ordinance. That's basically it. I appreciate your time and the opportunity to speak to folks. And again, all of these studies I cited are in the links. You can research them yourself. There was even a good one in Primus, where early in the year, a fellow in Santa Clara in California started doing a study in March and April that did the same thing with 0.002, 0.003% fatality rate. That study has been replicated and reviewed 82 times in countries across the world with the same mean results. We're chasing.
Mr. Gronkowski, your time is up.
Sorry. Thank you.
So yeah, now I'm listening to this. I didn't get to finish listening.
Brandon Rice.
And I'm running around cleaning bathrooms. I've done no teaching today. We're at.
Nope, I am fine.
Just a reminder, if you're calling in via phone, please mute your phones if you're not speaking. Do we have Don Hakes? Rita Volbrecht? Linda Larson? Tanya Hagan? Chair Smeyer, that was the list of verbal comments that I had. You're muted, Chair Smeyer.
It's unfortunate that we're having these technical difficulties, but these folks that you're calling on did submit in writing a comment and then indicated that they wish to speak. Is that correct?
That is correct, yes.
Let's do one last call. If there's anyone online who wishes to speak, please do so.
I had requested to speak.
And your name, please?
My name is April Duval.
Please go ahead.
Thank you so much. Good afternoon. I am a nutrition educator and a certified health coach. I have helped hundreds of people restore their health by focusing on something all of these health mandates are ignoring. The main concern during this pandemic, and really it should be all the time, is keeping people healthy and stopping the spread of any virus. The approach by the health department and government officials has been social distancing and masking. But we're forgetting about the most important parts of being and staying healthy. We stay healthy by having a strong immune system. And how do we build a strong immune system? By letting it do its job. It's meant to defend against germs and microorganisms. Yes, our immune system is there to protect against disease. So how do we boost that immune system? We focus on foods that we should be eating. More vegetables, more water, less sugar, less processed foods. So where are those mandates? Where's the strong-armed guidance telling people to eat a rainbow of colors every day? Where are the signs on storefront doors guiding people to health by suggesting, hey, up your vegetable intake today? Just this morning, I taught a nutrition class on vegetables with 3 second-grade classrooms. And we discussed why we should eat vegetables, why they're important to our bodies. They help heal our bodies. They help our bodies fight against germs. This is backed by science. Why isn't the science being listened to in these mandates and guidance on health and wellness? What else boosts our immune system? Activity, movement. But where is that suggestion? Where are the commercials and ads and signs asking us to have 60 minutes of activity every day? Where is the push to help your neighbor, help your community, boost your immune system, eat your vegetables, get active? Why the focus on masks and distancing? Let us be responsible adults. Let us make our own decisions about what is best for our health and the health around us. We do not need government officials telling us what to do for our body. If you're going to use your elected position to suggest what to do to be healthy, then please give the full picture of wellness: good food, activity, movement, water, and being together. Let me be clear, I am against this ordinance. No mask mandate. Please let our immune systems fight this battle. Let people choose to do what's best for their own body, our choice. Thank you for listening.
Let's call for anyone else online who wishes to speak.
I would like to make a note if I can.
And you identify yourself, please.
Yep, my name is Kayla Rick. I did not sign up to speak, but I emailed and asked to be seated in opposition. Can I just clarify when the names were read? Was I read in opposition of the ordinance or for the ordinance?
Samantha?
She's asking how it was read. Kayla, your comment was that you were in favor, however, opposed to the fines.
Opposed to the what?
Fines.
Oh,
The citation.
I'm fully opposed to the ordinance and the fine.
Okay, thank you for the clarification.
Yes, please recheck all of the names. I would hope that all of them would be correct.
Ms. Rick, if I could just clarify, I just want to, what I have that I sent to the committee from you was committee members and Board of Health members. I am in favor of individuals wearing masks to feel safe. However, I'm fully opposed to a fine being imposed on individuals. So if you do want to clarify, maybe just send a new one so we get that correct.
Sure, I'm in favor of individual choices. If someone feels that they would like to wear a mask, I am all about that. I do not agree with an ordinance stating that somebody must wear something that they may not want to wear. But I will re-email you. That's just fine.
Thank you. Is there anyone else online who wishes to present a comment? I see some lights lighting up, but I hear no voices. Is there anyone else who wishes to speak? Anyone else? Again, I assure you that if you had submitted a comment, a written comment to our clerk, to Samantha, and you indicated that you wished to speak, and for some reason you were unable, your comment is still forwarded to both boards, and it will be forwarded to the members of the county board. So one last time, anyone else who wishes to speak? We'll move on from public comment now. We'll move to, Mary, I'll ask you to help me with this. We'll move now to the file number 20-21-100, creating chapter 8.35 of the code, COVID-19 communicable disease mask requirement. I'm going to ask for a motion to bring it onto the floor of both boards, the committee and the board, excuse me.
So moved, Mr. Chair.
Moved by Supervisor Bates.
Yes.
I'll look for a second.
Neiman, second.
Second by Supervisor Neiman. And who is on the health board, right? Supervisor Neiman?
Yes.
Okay.
Chair
Right.
Price, you're muted, just so you know.
Who is?
I'm unmuted.
There you go. Yep.
Okay.
You're unmuted.
All right. It is now on the floor for discussion.
And before we start the discussion, I would like to remind the Board of Health members that if there are recommendations or questions raised from the Board of Health perspective, The intent is to share that information not only here with the county, but I would also share that with the city. And I'm assuming that that can come out in our discussion. I wanted you to know that information would be shared. And before we start in terms of the discussion itself, I would like to ask Lisa Giese to provide any additional or clarification information that she feels is appropriate from the fact sheet.
Thank you, Mary, and thank you to the Board of Health and County Board members that are part of this conversation. As you saw in the information sheet that was the cover of our packet, this is one strategy with this specific virus that we are dealing with in a pandemic situation. It's only one small tool in the toolbox to look at a policy like this, but it is seen as one that will be critically important if we don't have a statewide approach. You've seen laid out for you the process that has been gone through to bring it forward. This would be an ordinance that would be moved forward at the Eau Claire City Council level as well as the county board level for consideration and discussion, with the goal that there would be an ordinance in place if there was no state order to cover the county as a whole. There are a couple of things I would highlight to you from a public health science-based approach. First of all, there is clear and strong evidence that face masks are an important strategy in COVID-19 control of disease. We all have a shared goal to get through this as quickly as possible. We all have a shared goal now that we see vaccine on the horizon of getting back to as normal as possible following the pandemic. We are in a place now where face masks do provide, and the science is clear, some strong support in slowing down spread. The Centers for Disease Control, Mayo, in December published another report. There have been science-based, peer-reviewed reports out about the convincing evidence that face mask use by individuals in a community will slow down transmission between individuals, the individual that wears a face mask, slowing it down to others if they are infected and don't realize they're infected. There's newer evidence that it may also protect others if they are wearing a face mask from being infected by that individual. So a two-way protection, but minimally, it slows down spread from me if I'm infected and wearing a face mask to anybody that I am in close proximity with. We do have good information that it slows spread if there's a policy choice at various levels. So certainly school policy shows us that evidence. There are studies at a national level that states that have face mask policy have lower transmission. And those are the kinds of research reports that were made available to you in the links that were in the fact sheet. I also would say that, again, policy is only one tool, but we often have elected officials use tools like this for public health reasons to protect others, not to necessarily just protect the individual, but to protect the community. And your role as policymakers in protecting the community comes in various ways. Again, one very small tool that we think about in public health, certainly education and all kinds of other things we do are critically important to keeping community healthy, but this is one important one. One example that's been helpful to others to think about is no shirt, no shoes, no entry being a policy and a requirement of businesses. And that's for public health reasons as well. In the COVID situation, do know that the spread of an infectious disease actually carries enormously more risk in those public settings with close contact than even someone that walks in barefoot to a public facility. So do remember that we do already have policies like this, and this is really targeted at the specific issues with this specific disease. I am certainly available to answer any additional questions. It is, as I said, one strategy that is science-based and supported across really those vetted entities across the U.S. As one of our tools in the toolbox.
Thank you. Are there any questions for Director Gieseke? Is there any discussion? Sorry, Supervisor Bates.
Thank you. We heard in some of the comments this afternoon individuals who said, "My body, my choice." I think it might be appropriate to maybe go over that this really isn't about their body. It's about the people they come in contact with. So could you go, I'm from a generation when they pounded that chicken box sign on your door, or that measles or that mumps. And really and truly, it was a way that our children were protected in the sense that if you saw that on your neighbor's house, it wasn't time for Johnny to play with the individual who lived there. So I think there seems to be a misconception that this is really all about them, when really I believe that this is really about exactly what your job is, the public health. Would you talk a little bit about that?
Certainly, and thank you, Supervisor Bates, for that question. The basic science around face mask use is that individuals that correctly and consistently wear a face mask that is, again, made out of a good quality material and is fitted to their face will reduce the number of droplets that come out. And it's kind of the basic science that it catches droplets at your face that otherwise may be spread. This is a disease that, again, the air and the droplets will transmit virus to others. And it is in fact true that people that are asymptomatic or minimally symptomatic, they don't realize that the little bit of tickle in their throat or the little bit of runny nose they have is in fact COVID. They are infectious. And we have seen time and time again where people who have tested positive look back and say, oh, I think I might have had a little bit of a sore throat, or I might have had a little bit of a runny nose. I didn't realize that I was infectious and got my grandmother ill or got my coworker ill. Wearing a face covering in those situations, in all situations, reduces the risk from the individual that is either asymptomatic or minimally symptomatic from potentially spreading to others. And it's the basic public health principle. We've learned a lot since March about the effectiveness of this tool. It's why it's been widely studied over a lot of months now. And it is not perfect. It's not a perfect solution. But when we do it consistently and we require that that be done, it does become an effective strategy with reducing spread of disease.
Thank you. Supervisor, I'm sorry.
It's about protecting those around us. It's about protecting our coworkers and those people that we come in close contact with.
Thank you. Supervisor Wilkie, were you indicating a wish to speak?
Yes, Mr. Chairman, I had a question. You know, I've read mounds and mounds of materials, like I'm sure many of others have, and I thought I had come to answer for myself all the questions that I had. However, one thing was raised that I'd like some reassurance on. One of the speakers for public comment period was speaking about HIPAA violation, and I didn't get where we were in violation of HIPAA or what his argument was. Can I get some comments from Corp Counsel that in fact nothing before us is, in their judgment, a HIPAA violation?
Mr. Olafson, Mr. Eaton?
Yes, I heard the comments and didn't have any concerns about HIPAA myself. I was going to ask, but that's not the time for it, what specifically the gentleman is referring to. If he could be more specific, I would love to know any potential violation as well.
But at this point in time, you're not aware of anything that we have before us that would be a HIPAA violation.
No, I am not, Supervisor Wilkie.
Okay, thank you.
I mean, typically most HIPAA violations are going to have to do with somebody's identity and their medical treatment history or records. Here, we are not even identifying people in the ordinance. This is an ordinance for the general public. So there wouldn't be any identification as to an individual or their medical records.
I'm wondering if Janessa wanted to add anything?
I agree with both attorneys for Corporation Counsel there. I don't see any potential HIPAA violations in either the county or the city's draft ordinances.
Thank you. Supervisor Wilkie?
Yeah, that answered my question. I'll reserve my comments for later.
Okay. Other questions or discussion?
Chair Beckfield.
Supervisor Beckfield, followed by Ms. Spencer.
The fine dollar amount, how did you come up with that?
So I will ask, this is Liska, thanks for the question, and I'll ask Corporation Counsel on the county or city side or legal counsel on the city side to respond to the dollar amount.
Janessa?
Yeah, the $200 fine that's stated in both the county and city says mirrors that in the current state order that is subject to a $200 forfeiture as well. It's staying consistent with what is currently in place with the state order.
And have we implemented any of that so far, Leesky? Have we collected any fines in the time frame that we've had, or have there been any fines issued?
The process that the health department has used to date is to contact and document those instances where we receive complaints on either state order or local expectations. We work with the entities to talk and walk through that. We have not to date levied any, worked with the state, in this case, the state order to levy any fines. It's a different process because it's not a local ordinance, but that has not gone through to utilize that tool of enforcement, no.
Supervisor Beckfield, are you trying to get to the point of what happens to the money that's collected in fines?
No. I don't think we've collected any of it, and that's been up in the first place. And then the second thing was who is the enforcement tool you would use? Is it the police department in Eau Claire? Is it the sheriff's department? Who would be the one that would levy that citation?
Like we do for other health department oriented ordinances, the health department is an entity that could document that violation and move forward with the recommendation of citation. We would not use law enforcement in these circumstances. We do currently and would with this take calls and documentation of concerns from a variety of entities across the city and county, but it wouldn't be the responsibility of law enforcement to ticket anyone.
I was reading in some of the notation that a few of your members felt that a $200 fine in comparison to the marijuana fine of $1, if I remember correctly, was part of your discussions in one of your meetings. I'm still curious. Okay, so we're using 200. Would we consider lowering that fine if it were something we think should not be as bad as that, for example? Is that open for discussion?
To whom are you directing that question?
Well, to the people who wrote this ordinance, I guess is my question. I had nothing to do with it.
I think that to answer your question directly, any piece of legislation is open to change in the future.
So,
The question,
so at the board, we could bring up $1 if we want to, right, at the floor.
you could do that. You have that privilege.
And then is there any other counties currently with extending right now? I'm trying to find any other county in the state of 72 that has a similar ordinance under consideration on something we don't even know that's not going to happen. Hopefully the governor will extend it, but are we smarter than the rest of the state, I guess is my question. And what other counties are you aware of? Because I can't find any that are considering such legislation at this time.
Madison.
I don't see Madison listed, but I'm just saying, I'd like to see more. We're doing a what if situation here on legislation if something would happen. That's all I have. I really think this could go back to committee and be thought about some more on the task force personally.
Mr. Chair.
Supervisor Bates, followed by Dr. Padot.
Thank you. I think that basically here what we're trying to do is to be prepared that if the governor's particular requirement doesn't exist, that we have something to fall back on. And looking not just here in the state of Wisconsin, but all over the country, they have fines that are being collected in regard to this issue. However, I think it's been very clearly the practice of our health department to work with individuals way before we get to the point that there is a fine, to be able to discuss how they can indeed continue to operate through the use of various techniques. And maybe that has a great deal to do with why there haven't been any fines, is that is already in place. So I would hope that we wouldn't be thinking of this as it's sort of a place of last resort, that obviously the first steps would be, how can we help you stay in business? What do we need to do in order that you can operate safely and so the patrons who come here can feel safe? And when it gets to the point where you have maybe a group of 75 or 80 people come in with no masks, is that a different scenario after they have been advised how dangerous that can be? And what is the purpose of having a fine? So they know there are parameters, but it doesn't look to me as though that has been the whole of this. It looks to me as though there are all sorts of steps before you get to that point. Thank you.
Dr. Padot.
Thank you, Mr. Chairman. I would just like to go back to the scientific basis by which we are using for this. And I would like to just emphasize that this is clearly the right thing to do from a public health perspective. There's should be no dispute about that. I did read through as many of the community comments as possible, and there are some cherry-picked studies, but the CDC has reviewed 45 high-quality studies that document something better than a 70% protection. And as Ms. Giese was addressing, it's a two-way protection, both control from the source and control of the user. It's also well documented that asymptomatic spread, people who do not have symptoms at the time, are responsible for creating and spreading 50 to 60% of new cases. So these are people that do not know that they're sick today that might become sick tomorrow or the next day, and then retroactively we trace down those contacts and we realize that they have infected a whole host of people. And in fact, when we look, and I have been devouring this. I've just my background. I've been an occupational medicine physician living and working in the world of industrial respiratory protection for more than 30 years. Some of the commenters were saying, well, this is not perfect. No, I've worked with military gas masks and industrial respiratory protection, and none of us want to wear those all the time. But 70% protection is a whole lot better than nothing. Super spreader events, as they have been noted, are responsible for a lot of cases, and all of the ones I have been able to delve into have been unmasked. The cases, the patient zero, so to speak, has been unmasked. It's also quite clear in various legal jurisdictions that when measures like this are undertaken, new infections fall significantly, and that businesses are more able to reopen, and the need for lockdowns and more stringent legal control mechanisms are reduced. By going with a mask ordinance like this, we can actually maintain our public health, we can maintain our business community, and we can move forward in really what may turn out to be the most graceful way possible as we all wait for our vaccinations and we can reach that threshold of herd immunity that may occur sometime in, who knows, 6 months, 8 months. I don't know how long that timeline will be. But I strongly urge the county board and the Board of Health, and in fact the City Council, to move forward on this, and at least a measure of this type, as it's very clear that scientifically this is well supported. Thank you.
Thank you.
Nick, if we could go
Mr.
back
Chairman.
to Elizabeth Spencer, she's been waiting for a long time.
I'm sorry, Mary, could I cut in for a moment? Ms. Spencer has been waiting to speak. I'd like to give her the opportunity, then come back to you, okay?
No, that's what I was saying, so that's good.
Sorry. Excuse me.
Hi there. Thank you. Actually, Supervisor Beckfield asked my question. I wondered about the derivation of the $200 fine, but when I read a lot of the opposition, a lot of it was about enforcement. So I wonder if Lisa could speak to that a bit. I don't think this is like when I'm in the grocery store and some person beside me suddenly comes up without a mask and is like 6 inches from my face reaching for something on the shelf. I mean, I'm assuming that's not the person, but this would be like an entity that flagrantly violates this with renting their space. I shouldn't speak. I would ask Lisa to give us more information about enforcement, because that seems to be a major source of opposition.
Lisa?
So I can share a couple of comments about that. As said earlier, to date, we have not enforced the state mandate. We've used it as an education tool. Many entities have used it as a shared platform for community expectations. It's been extremely helpful to many organizations across Eau Claire County to have the shared expectation that face masks be used. It gives them the ability to make it just part of how they do business in a way that is consistent and science-based. Our approach, as I said earlier, is one of education. It's a difficult ordinance to enforce, and I think the general public is well aware of that. We don't have people available or interested in watching for individual violators of this type of an ordinance. The goal is to have clear community expectations, to have organizations across Eau Claire have the same requirement that face masks be part of what's utilized in their indoor spaces. And our conversations will be at that organizational level, most likely. We will certainly get complaints and concerns expressed, and we have already. Our focus has been to work with the entities where face mask use is not just part of their practice, where they are not creating an environment to make it just an expectation that face masks be used, and helping them strategize how to do that. We've done that with schools, we've done that with businesses, we've done that with all kinds of settings, and it largely works. And that would be our focus with this local ordinance as well.
Chair Beckfield.
Supervisor Beckfield, followed by Supervisor Wilkie.
Another consideration is, how did you come up with the 6-month distance? Why would you consider, or should we consider, something that would be a recurring? And if this, for example, on a recurring basis or a repeating situation, I don't know how to say that, be it on a 30-day, 60-day, 90-day, why was the 6 months picked? Is that number?
Certainly, I will, legal counsel for both city and county may additionally weigh in on procedurally why that made sense, because certainly that was part of their discussion. From a public health standpoint, we do know that we have a good amount of time until we have the protection in a community, again, that community level protection with what we're hoping will be vaccination. It'll take some time. So certainly for the basic spread of this communicable disease, that 6-month time made sense. It also is possible, obviously, for others to, the city council or the county board, to consider bringing that back. But I know that legal counsel likely had a specific reason for 6 months as well.
Legal counsel?
I was not involved in that. I don't know if Janessa can speak to why that date was used.
There's nothing magical about the 6-month date, but ordinances, we like to provide certainty. So a revolving date that, comes back for consideration every 30 days or 60 days is not something that we would want to suggest or recommend be in an ordinance. So an ordinance like this that hopefully has very limited duration, we've written it to have a sunset date of June. And it can always be repealed earlier if it's warranted or, recommended or just voted on by the county board or city council.
Supervisor Beckfield?
Getting facts. Thank you.
Thank you. Supervisor Wilkie, did you wish to speak?
Yes, Mr. Chairman, thank you. As I was sitting here thinking, and I got some comfort level hearing from our Director of Health, that we don't lose focus on where we need to pay attention to, that of the education of our community. We truly, to make this work, we've got to change the hearts and the mind of many of our citizens, that they choose to wear masks. The great majority of individuals in our community are already doing that, but hopefully that if we move forward with this ordinance, that we don't get hung up on enforcement, but keep our focus on changing those hearts and minds. For some people that you can't change their hearts and minds, maybe a fine will be the choice to choose to care about others. I've said before, we are our brother's keeper, and if we pass this ordinance, we're not doing it to take away individual freedoms. So what we're doing is trying to protect all our citizens of our community. But let's keep focused on changing it within their heart, that they do the right thing through the education process. And I trust that the health department's going to keep their focus in that direction. And maybe our health director wants to speak more too about the education of our community and doing it for the right reason, not because of a fine.
Thank you. Mary, I cut you off earlier and I apologize.
No, that was okay. I was just reminding you that Elizabeth Spencer wanted to speak, so you covered it. I'm just wondering if there are things that haven't been mentioned yet, concerns or questions that haven't been covered, that we need to make sure and get those out here and discuss to keep the meeting moving along. Jennifer, and then Emily.
Thank you, Mary, and everyone. I guess I just wanted to point out that one of the most disturbing things about COVID-19, people dying and people getting sick, and the economic devastation is all terrible. But I think another thing that we don't often talk about is just how much, how differently it affects different people. And the people who seem to be affected the most tend to be the most vulnerable in our society. And I just was thinking about that. I believe in freedoms too. But some of the people who were speaking, I guess I would just put forward the idea that there are a number of people in our community who kind of have to work at frontline service jobs in order to feed themselves and their families. And they may have an autoimmune condition or some health risk that makes them more vulnerable, but they don't have the luxury to stay home. And I guess I would, well, number one, compliment the health department and the Chamber of Commerce for their caring is contagious kind of public health view, and just for us all to be thinking about it's our job to look out for the most vulnerable in our community. So thank you.
Thank you, Dr. Eddy. Supervisor Henning, were you waving at us?
Yeah, yes, I have. I got a comment that was given about wearing no shoes, and that's not a law. That's up to the individual business if they want to put that. That isn't a law that's required of all businesses, so that shouldn't have had any effect on this conversation. It seems like the $200 amount is a scare tactic in my mind. Now, it's unenforceable. You're not trying to enforce it, but you're trying to put a $200 fine on a person who doesn't have $10 or the mask in their pocket. It's not enforceable either way if by the amount of money that people have, or being fair. It's a very unfair amount of money. And you talk about enforcement of it. How about all these stores that say masks are required, and you walk in the door and 60% of the people don't have a mask on? You don't go in there and arrest that store owner, but you're going to wait on the corner if you got a policeman, which I don't say there are any of them, that wanted to be mean and sat on the corner and gave everybody that didn't have any money in their pocket money if they're walking down the street and don't even go in the store because they're outdoors. So I think this whole thing has to be looked at again. It's very unfair, and I think we should wait and see if the governor does anything before we jump in with something that may not even be realistic after he gets something done. So to second guess what's going to happen with the governor's ideas, I don't think is fair. I think it should be relooked at, and so I guess that's probably enough. I can't support it the way it is.
Thank you. Other comment or discussion? Emily? Bergie? You have to unmute, Emily.
Yep. Thank you, Mr. Chair. And thank you for this discussion and conversation. And thank you to everyone that's commented as well. And I think I've read every comment that has come through. So thank you for people that did that. And in fact, my question is related to one of the comments from Mr. Scott Rogers from the Chamber. I appreciated getting his feedback. And he had a question in his comments I just would like to ask. I'm just pulling it up here. I just want to say too that he said that they got very little response and no one raised an objection when he sent out the draft ordinance and the letter that was sent out. But he did have a question from a member that clarifying that an individual working alone in a private office would not need to have a mask on. The way I read both ordinances, I would say that is correct, but I just wanted to clarify that.
Iska?
That is correct. This is really focused on public spaces, not on a private office.
Thank you.
Chair Beckfield again.
Supervisor Neiman first, followed by Supervisor Beckfield.
Thank you. And thank you for all the comments. This discussion is really great. We need this kind of thing. And I appreciate the people that have commented from the public. I think that we have suffered from lack of a clear path and confusion about what is true and what is not true. I think an ordinance like this is an important way to say to the people that this is important. This is critical. It's more than just do I want to or do I not want to. I think it's also good to be ready in case Governor Evers' mandate is vacated, because to let time lapse potentially exposes more people to disease and encourages the spread. Thank you.
Supervisor Beckfield.
I want to thank the board for all their hard work, because I know you put a lot of time and effort in as well. And I do appreciate the public's input. And I have a number of questions that I'll bring at the county board at that point. I also want to say I think that the carrot needs to be out there better about a public service message about why you should wear a mask, explaining those things. Get more positive on this thing than taking a stick out and say, you do this or you're going to get a $200 fine that we're not really doing. So that message means nothing to me. And what I'm saying is I think, I'll be honest with you, I think Eau Claire County's done a pretty damn good job, excuse for my D word in there, but of doing proactively and educating. And I think our health department has done a good job of communicating the numbers and what's been going on. I see the sites where people are being tested around town. I just think maybe if we can come up with a positive message that we can help reinforce whatever finally does come out of this, if something comes in there. I just want to think on the opposite side of that fence, not necessarily on the negative all the time. We always seem to come up with a fine, but again, this is not a good situation that anybody wants to be in. But again, Lisa, you're probably not getting enough thank you. I know you're taking a lot of heat, and the rest of everybody else is feeling a little bit of heat too, including us supervisors at this time on this topic. So again, I'm going to say thank you and shut up for the rest of the time. Thank you.
Further discussion or questions?
Ray Henning.
Supervisor Henning, followed by Supervisor Bates.
Mine's short. I just want to remind everybody, I do wear a mask all the time. So, but I do represent everybody in the county, and I've got a lot of comments both ways. And but I do always wear one. I support wearing a mask, but I have a problem with the way it's written up. Thank you.
Supervisor Bates.
Yes, thank you, Mr. Chair. I think really when I certainly sympathize with the notion that there would be a $200 fine for an individual. I'm not sure that was the intent. I think that basically one of the things that maybe could be explored is if an individual has a gathering of an unacceptable number of people without masks, then I could see that there might be a warranted response of the fine. Are we going to go up and down the street and look for one person without a mask? I don't think that would be a logical thing to do. So maybe if the fine is the issue, we could look more closely at when that would be appropriate and find perhaps a way to look at something that creates a much greater risk in thinking about that fine. Thank you.
Chair, I lied.
I'm sorry, I'm going to hold you to your word, Supervisor Beckfield. Go ahead.
There really isn't any change in the ordinance in that we'd be walking our dogs or that kind of stuff wearing a mask. Am I reading this correctly? It's really basically the same as we have it today. It's not a massively any changes of any kind, correct? Okay, sorry. I'm going to confession now.
So
I can clarify. Sorry, Mary.
No, go ahead.
The one change from the state order. So again, the fine is the same. The language is largely the same. The one change was that this ordinance would require that businesses post a sign on their door. That is not currently true for the state order. We did add a section that would require that action of a local public-facing entity.
I'd like to add a point of clarification in regard to the enforcement. It seems to me that what we're hearing today is that the enforcement is for persons who are intransigent in regard to the mask ordinance. I remind you that many businesses, when you walk in, it'll say you should wear a mask, but many of the places I go to have masks sitting right there. And they say, if you don't have a mask, here is one. So just to be clear, and Lisa, you can correct me on this, it's my understanding that fine is really a very last point. And that would be for persons who are intransigent and would be perceived as presenting some danger to the community in terms of communicating the disease. Would that be a correct statement?
Again, our goal from the start with COVID-19 has been around education. And in every case, when we had a local order, when we've had state orders, it's been leading with education and conversations with entities, in this case, about their practices. And we have not to date moved forward with enforcement. And that's been deliberate and strategic and coordinated with our Chippewa Valley Economic Recovery Task Force, which is our business connected group, as well as our schools and other entities. So the state order made the decision to place the fine at an individual level. We mirrored that. My goal is to have the basic practice of wearing masks be an expectation in this community moving forward, and this policy supporting that.
May I add one other point to what I just said? That my understanding is that the application of the fine is discretionary, not automatic, highly discretionary. Would that be correct?
I certainly would want, yeah, go ahead, legal counsel, thank you.
That is correct. We would have prosecutorial discretion, being that it's a county ordinance.
Well, and beyond prosecutorial discretion, I'm thinking at the front line of the health workers and so on. I'm sure that they would apply great discretion in the application of that, realizing that the fine's purpose is really to set a boundary beyond which you really shouldn't be going, or you present some problem to the community. So
our process, and we have a process map in place for a process. We get a complaint, we follow up on all complaints, we do education, we go on site if necessary to have conversations. We document that interaction and document the non-adherence to what the expectation is, and then we follow up. That is our process. well down the line with really egregious disregard of any type of local public health ordinance would be the process where we would be talking to legal counsel.
There is one aspect of the pandemic we really haven't talked about, and that's the long-term effects. Because we tend to focus on people dying or winding up in the intensive care unit. My son and daughter-in-law have had COVID-19. My son, they both survived, but my son has long-term effects that have to do with his gastrointestinal tract, his heart, his blood pressure. And I think there are many people who suffer the long-term effects. And that's a serious public health concern. So we're not just protecting people from death or the ICU, we're protecting them from really serious long-term harm. And there are probably, I don't know what percent of people, maybe Dr. Badeau knows this, but some large number of persons suffer the after effects that, as far as we know, can go on for months and months and months. It's now 6 months for my son. So it's just something we haven't really focused on that we ought to be thinking about. It's not just death or ICU. It's the really serious effects of the virus we're talking about. Ms. Spencer, did you wave at me?
Chairman Smyer, this is Mary.
Sorry, Mary.
I would like to just take a check here because I know you have a long agenda after we leave. We take our vote and leave. And if the Board of Health members feel prepared to take a vote on their responsibility for moving this forward, I would suggest we take a look at that and make that happen.
That would be fine. I also, on top of that, suggest that the vote is taken is a roll call vote.
Yes, yes.
Okay.
So
that's your decision. Go ahead.
Okay. So we don't need another motion, correct?
That's correct.
Okay. So from the Board of Health, I'm just asking Board of Health members now in terms of the review and recommending of approval for ordinance file 2021/100 to create chapter 8.3 of the code, as well as recommendations to the city for this. I'll do a roll call and please indicate whether you are in favor or oppose. Emily Berge?
Aye.
Don Badeau?
Aye.
Jennifer Eddy?
Aye.
Mark Kading?
Sorry, I have to get unmuted.
That's okay.
I'm going to say nay.
Okay, thank you, Mark.
You're welcome.
Martha Neiman?
Aye.
Liz Spencer?
Aye.
My vote is also aye. Okay, thank you. So we have approved to move this forward, and I'm sure much of this discussion will continue again at both the county and city level, especially the points that have been raised. But at this point, the Board of Health, Mr. Chairman, is ready to move this forward to your Committee on Administration. And
thank you. And my understanding is that on the vote of your board and the vote of the committee, that this item would move forward to the county board. So thank you for the clarification.
Okay. And so at this point, I'm sure if Board of Health members choose to stay on and see the rest of the agenda, it's a public meeting, but I know that some of you have to be departing for other commitments. So thank you for your attention today. And Mr. Smyer, thank you for the opportunity to do this jointly.
Thank you for your work on this.
You bet, you bet.
So I'm assuming you're adjourned now.
We are adjourned.
Thank you. Okay. So members of the Committee on Administration, I'm assuming that you also are prepared to vote. Am I correct? Okay. Samantha, will you do the roll call vote for the Committee on Administration?
I can. Supervisor Henning?
You're muted, right?
Oh.
Beckfield,
No.
Bates,
Yes.
Wilkie,
Yes.
Smyer.
Yes,
3-2.
thank you. The motion passes. The item will now move on to County Board, along with the vote of the Board of Health. The next item on our sorry. Oh, the next item on our agenda is review and approval of committee minutes. And I think Samantha has an explanation why we have March the 17th there.
Absolutely. So County Clerk advised me that we have not submitted or approved March 17 minutes. This meeting was a meeting prior to the county board meeting, so was at 6:30 and took up 2 of the pieces of legislation that is listed in those minutes. Unfortunately, we do not have who was which way, but Administrator Schaaf advised me that both had passed at that time.
Okay, I'm going to suggest that we do these separately. A motion regarding the minutes of March 17th, 2020.
Beckfield moves.
Beckfield moves. Second.
Henning
seconds. Any additions, deletions, or corrections? We'll do it by voice vote. All those in favor of approval of the minutes of March 17th, please indicate by saying aye.
Aye.
Aye. All those opposed by nay. It is unanimous. Thank you. Motion regarding the minutes of December the 8th, 2020.
So moved.
Moved by Supervisor Bates.
Second, Supervisor Wilkie.
Second by Supervisor Wilkie. Any additions, deletions, or corrections to those minutes? I hear none. All those in favor of approval of the minutes of December the 8th, 2020, please indicate by saying aye.
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 All those opposed by nay. I don't think that was a nay. Okay, it's unanimous. Thank you. Next is an update of COVID-19 task force. Administrator Schaaf, are you still here?
Yes, sir, I am. Thank you.
I don't see you anywhere.
Yes, can you hear me?
Go ahead.
Okay, thank you. Supervisor Wilkie may also want to share some comment. There was some discussion at the last Finance and Budget meeting, and we have been having conversations at the staff level as well regarding the COVID-19 task force. That task force was in place to actually administer and work through the dynamics of the bridge plan that was in place for 2020. Now that we are in 2021, there are a number of positions that were left unfunded as part of the adoption of the budget, and that was the specific discussion that the Committee on Finance and Budget had regarding how do we as a county government want to potentially bring those positions back if for some reason one is deemed to be needed mid-year. And there was some discussion about how that would actually happen. We have a mechanism currently in place which would require that the individual department bring it to their oversight committee and then to the board to actually have that acted upon. And there was discussion on whether or not that would be too complicated for those who are seeking to have those positions come back. And I think there was some dialogue about whether or not the board would like to reinvigorate or extend the COVID-19 task force. That would take affirmative action on the part of the board to say, yes, we need the COVID-19 task force to continue. As of this date, as you're all aware, we're working with our public health partners to roll out vaccine to area residents, as well as taking proactive steps to minimize the spread of disease. The Economic Recovery Task Force continues to work to help our business community, and we continue to monitor some of the bigger picture metrics of what's happening around not only the state, but the nation as well. We are continuing to be very cautious, as right now, one of the newest metrics that we have heard is Legislative Fiscal Bureau came out and indicated that the state's general fund tax collections are $380 million behind the prior year. And so we do know that there are implications to the COVID-19 pandemic. We are not completely completed with it, and we have not gotten through the entire cycle. At this time, it is believed that the budget, because of the conservative numbers that were taken for sales tax and the consideration that was given by both the Finance and Budget Committee and our management team, that we have a budget that we can live with for the duration of 2021. And so this was on your agenda to provide that update, with the reminder that if there is a desire to have the task force reinvigorated, that it would take affirmative action by the board. In the last number of meetings, we were providing updates on some of the numbers of our quarterly reports. I would anticipate that we would still provide that information to the board as a whole on a regular, ongoing basis. And Chair Smyer, with your permission, Supervisor Wilkie, of course, was part of the discussion at Finance and Budget. And I don't know, Supervisor Wilkie, if you want to share any of that dialogue as well.
Supervisor Wilkie?
Well, the only thing I can add to the administrator or ditto on is, of course, the concern that if you've got an allocated position and no funding allocated within your 2021 budget, you certainly don't want to make the mistake of going ahead with those positions ultimately being filled and no funding in place without a strong reassurance and track record going forward that you're going to be able to stay within your individual departmental budgets. That was the key thing. They can't be filling those positions if there's not dollars in the budget that's going to carry you through the year. So we didn't want to just people start filling, or departments start filling the positions with the hope that there'll be enough money left there. I think a fiscal impact needs to be really brought forward that demonstrates that there will in fact be money there to carry you through the year. If that is done through the task force, is it done through a different committee, or within the fiscal impact statement before that position is filled. But don't go ahead and fill those positions without some oversight of some kind.
Supervisor Wilkie, wouldn't it require a budget adjustment to do that sort of thing?
I would think so, but the administrator can weigh in here. Technically, those positions are allocated and a department could go and hire. It wouldn't be very wise or responsible to do that without some fiscal analysis done that there's clearly going to be sufficient funds within that department for the entire year. You don't want to fill positions and come the end of the year, well, whoops, we went over budget. So I don't know.
Sorry.
I don't know that necessarily technically they've got to do a budget amendment. That might be wise to have that in place, that, yeah, you got to bring a budget amendment to the board and get the board approval. If it's thought that already the case, great. If not, then we need some legislation that says you need to do that.
Yeah, I would be comfortable with that approach. Administrator Schmidt.
Yes, and I can tell you that we've had Corporation Counsel review this, and it would take that budget amendment to actually move that position back into place. And I would encourage that we maintain that level of scrutiny on the process, especially as we move forward through the year and we continue to monitor the impacts of COVID on our community and on our services. It would be, I think, somewhat problematic to bring a position back and then at some point have to have conversations again about other strategies that affect our current workforce. So I would prefer that we as Supervisor Wilkie indicated, stick with that more stringent review of those positions.
I agree. Supervisor, I'm sorry, keep doing that. Administrator Schaaf, are you done with your comment?
Yes, I am done. Thank you, sir.
Okay. Should we look for, supervisors, should we look for reestablishing the COVID task force? Because it automatically ended on December 31st. If we're going to have it, we have to have a new motion.
Chair Beckfield.
Second debate.
Beckfield first.
Oh,
yeah, I think we should. I make a motion to have it.
Supervisor Bates, hold on just a second. I think Administrator Schaaf wants to add something.
Yes, please. And it is on this agenda for discussion. And so what we will do is, based on the input that we have just received, that there is a desire to see that continue, we can draft the resolution and have that prepared for the January meeting of the county board. And this committee can meet prior to the county board meeting for a very small duration of time and approve that resolution. So we will begin working on that and get that drafted for your
I
consideration.
think it would be best to do it with all possible speed.
Yes, we will.
If we're going to have it, we should have it in place. Supervisor Bates.
Mr. Chair, I was only going to second the motion, but if you don't need it, not a problem.
Well, no, we don't at this point. I think what Administrator Schaaf is pointing out is that we have it marked on the agenda for discussion. We really can't take action on it unless we said that on the agenda.
Thank you.
That's why.
But we can prepare all of the materials and have them ready for you for a meeting prior to the board meeting and have that resolution as part of the packet for the January meeting.
So supervisors, can I assume your consent for that?
I'm comfortable with that, Mr. Chairman. Just if it could be reiterated or more added to it, a clear definition of what the parameters are and are not for that task force, I think would be important if we're going to up its time.
Well, Supervisor Wilkie, I'd ask that you consult with Administrator Schaaf and whoever else may be working on that resolution to ensure that those parameters are the ones that you're looking.
Mr. Chairman?
Yes, sir.
I think that we should get this draft sent to us adequately time ahead of time so we can make a decision when we get there instead of mulling it over. When we do, we should know what it is and be prepared to vote.
I agree. Thank you. Administrator Schaaf, I'm assuming you can do that.
Yes, sir, we can.
Okay. Thank you. Anything else on that topic? Okay. The next item is annual local legislator event. I think this is informational. Administrator Schaaf, are you addressing it?
Yeah. Yes, and Samantha will join me in this. Every year, we, the county, host a local legislator event where we invite all of the other local governmental units as well as the legislators to share in a meeting. Typically, it was in the form of a breakfast that we sponsored, and we had done it in January. Samantha has gotten input back from our legislators, and the timeline that they would like to utilize is slightly different, and it moves the meeting to the fall. And so we wanted to discuss with this committee today the moving of that meeting to the fall and what that format might look like. We're assuming at this point that it's likely going to be advisable that it may be virtual. Samantha, do you have additional information that you would like to offer?
Not really, just that last spring, after we had to cancel the legislative breakfast due to COVID, we did put a doodle poll out to our local representatives, and it was advised that springtime was okay, but fall was better because it was away from the elections. And that's probably a good thing this year. Hopefully we can get back in person, but we do also need to plan for maybe a virtual get together with our representatives if needed.
Mr. Chairman.
I'm sorry, who was the first there? Was that Supervisor?
Colleen, you can go first.
Go ahead, Colleen.
Thank you. My only concern about waiting till fall is considering the issues in regard to the shortfall that's expected in revenue on the state level. By the time we get to fall, it's going to be too late to have much input.
Yep.
So my feeling is that not practical. I think we should try maybe for at least where they're not already having everything settled. Maybe sometime in June, maybe May.
Is that a deal, Supervisor Wilkie?
Yeah, that Supervisor Bates, glad you had to go first. That was one of the two things I was concerned about. Wait that long. We've missed our window maybe on some issues. My second point would be that it might be wise on our part that we ask governing committees to be thinking about what they would like to see to bring forward to the legislators rather than a scattergun type approach. What are, maybe 3 issues that we want to bring to our legislators and hopefully have some unity as a county, maybe first starting the conversation at a committee level, what's important in your area, and then be prepared to come forward with 1, 2, 3. Here's what we'd like to see happen, and what is your position as a legislator? What can we expect from you? Preparing for them before they are here, and I think would be wise, along with what Supervisor Bates has said, better sooner than later.
Okay.
So what I'll do is I will connect with our local legislators and propose some days and times in May, maybe early June, if that is good for the committee members. And I will reach out to you and advise you what times are good for them, and then we'll decide on one.
Thank you. Supervisor Bates.
Just a quick one addition, and remembering that the resolutions that counties bring forward go to the WCA organization in order that they can be prioritized for the effort of the lobbyists to be able to speak to them in Madison. So I think that would also mean it'd be more coordinated. So not only we push our issues forward, but then we bring them to the WCA in order that we see if other counties are feeling the same, and you get a more unified voice.
Thank you. So Samantha and Catherine, do you need more from us to proceed?
No, I don't think so. From what I understand, we'll be doing a virtual event before summer.
Okay, thank you.
Yes.
The next item on our agenda is appointments to 3 entities. The first is appointments to the Highway Building Committee. These are all appointments that I have made. In the case of the Highway Building Committee, that's in the 3 of them are in the resolution anyway. So I'm appointing myself and Vice Chair Bates and Second Vice Chair Wilkie to the Highway Building Committee. Member of the Highway Committee is Supervisor Henning, who jumped on it right away and volunteered immediately. So I'm appointing him. Supervisor Leary, who's not on this call, and 2 additional supervisors, Supervisor Dunning and Supervisor Gatman, who happens to be on this call. And I'm looking for confirmation of those appointments.
Chair Smyer.
Yes, sir.
Since I'm the only one not on there, I make that motion.
We tried to help us avoid a conflict of interest on that.
Whatever. I'm just letting you know.
Okay, the motion is to confirm the appointments made by Supervisor Beckfield. I'll look for a second, as conflicted as that will be.
Want me to do it again?
No. No. I'm looking for a second from someone else.
I'll second it unless Supervisor Beckfield wants to replace me on there.
Thanks, Jerry, but I'm a little tied up right now.
Yeah. Nice try. Okay. All those in favor of the appointments, please indicate by saying aye.
Aye.
All those opposed by nay. Okay, thanks. The next one is appointment to the Human Services Board. I've appointed Jim Catlin, and I'm looking for confirmation of that appointment.
To move that we accept Mr. Catlin.
Okay, you're confirming. Thank you.
Confirming.
Thank you. Could I have a second, please?
Second confirmation.
Second by Supervisor Wilkie. All those in favor indicate by saying aye.
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 All those opposed by nay. It's unanimous. Thank you. And the last is the Broadband Committee, Mr. Tom Lange. Again, it's confirmation. I have appointed him. When I say I've appointed these people, in many cases, they've already been sitting with the committee and acting with the committee. So, Chair's looking for confirmation motion for Tom Lange.
Henning will move.
Henning moves. Hello.
Supervisor Wilkie will second.
Wilkie seconds. All those in favor indicate by saying aye.
Aye.
Those opposed by nay. It's unanimous. Thank you. Future committee meetings. I think we've already indicated some items we'll have for discussion. I think at our next.
Mr. Chairman,
sorry.
can I bring up one item I would like to see on our agenda for discussion under that?
Give it a try. Go ahead.
Okay, that wasn't very enthusiastic. Okay.
At the end of the meeting, I'm a little fatigued.
Okay. Mr. Chairman, I would request that we have our administrator speak to the Wapaka County Administrator and then provide a report to this committee and discuss why and what happened with their Department of Human Services contracting with ALEA. I'd like a report from the administrator.
Supervisor Wilkie, I can give that report. I spoke with the vice chair of the board of Wapaka on that topic.
Maybe the administrator can also check with their administrator and both of you could give a report.
This is Catherine. I don't believe that they have an administrator, but I will find, I can find someone to potentially talk to and see what we can learn.
Okay, so I would like a report and a discussion at our meeting.
We can put that in for discussion. That actually, if we have to have that brief meeting before the next county board meeting, that would be the second meeting. It would be the next regular meeting. Okay.
Next regular meeting I'm looking at, put it on our agenda.
That's fine. See, what else did we put forward? I don't think we had anything else put forward. Okay. We have reached the end of our business. We are now adjourned. Thank you.
Thank you, Mr. Chair.